here. I know some of you are those living with PD, and some of you that are joining today are caregivers, care team for your loved one or friend. So I've been asked to come on and talk to you about different resources that you may or may not have put into place or thought about. And very similarly to preparing for the future or anything, it's good to have information ahead of time to do research on versus when you're in a situation where you need assistance right away. So I'll get into the program now, and I wanted to just tell you that I work for a lovely couple that have been doing business for 10 years, Phil and Lily Hoteling. Lily is a geriatric care manager, and I'll talk a little bit more about that. And Phil does senior living placement, and I help with all things resources, whether staying at home or moving or just needing general resources. Okay, so for the goals for today, we're going to learn about some planning tools as those life transitions happen, being prepared, of course, about what options are out there. We talked about the possibility of changing needs and sort of being on top of that prior to, if not, what to do when you have a changing need, and who should be on your team, who should be helping you through this. So I'm not sure if you all have done what's called the MOST form. The MOST form is something that every patient should do, whether you have Parkinson's or not. And this is a conversation and appointment with your doctor. It's a legal form, and in Colorado, it's called the MOST form. It really goes over the things that you want to know and understand about end of life. It's not a fun thing to talk about, but it's certainly good to understand it. How many days would you ever want to be in a feeding tube, or you know, those kinds of things, and they can explain the quality of life with your decisions. How many days do you want to wait? If you're on a ventilator, for family to get in, that kind of thing. So the MOST form is really important thing to make a note to talk to your doctor about, because they can explain the quality of life towards the end and what decisions mean when you say yes or no to them. And then making your personal preferences known. This could easily be, you know, what kinds of things, if you become in a place where you cannot speak or you cannot make decisions for yourself, you know, that could be that maybe some form of cognitive decline is coming through as well. Just really talking to your family about things that you want them to know about your personal preferences. My dad originally wanted to be buried, and then later on, when he was 99, he told us he'd like to be cremated, so we made changes to that. He talked about the way that he wanted his funeral to be, who he'd like to speak. So it was easier for us as a family to be able to honor those requests. Of course, your power of attorney for your health and finances. So if you do not have this done, it's really important to do, to set up a power of attorney. If you are one that's living with Parkinson's, and even the caregiver, to be able to establish who you want to make health decisions and finance decisions. And again, this only comes into play when you are unable to make those decisions. But to have that, you can always change it. They say to really to review it about once a year, if not every 3 years, if you need to make changes. There is a document out there, and I just learned this over the weekend listening to an attorney. It's a great document. You might get it at the hospital, you might pick it up at a senior center, but it's called the 5 Wishes. And really what I learned from this attorney is that if you sign that document, it says it right inside there, it negates everything that you might have already done with your attorney. Let's say you went to see an elder law attorney, you established power of attorney, you did your will, you did your HIPAA. This 5 Wishes ends up negating all other legal documents. And what she said is, if you already did your directives, sent out information to your family members, and then you come upon this 5 Wishes, and you use that too, thinking, oh, this is lovely, it negates all the other information. So be aware of that. Talk to your attorney about that. Make sure that you have that those other documents that supersede it. So how do we pay if we need to bring in home care? So if you are a caregiver and right now everything is going really well, or you are one living with Parkinson's and you are doing really well, at some point you may need to bring in extra help or consider moving to a community. So how is this paid for? Again, this is just preparing and understanding. So private pay is typically what pays for home care because they're considered non-medical. They do things like meal preparation, light housekeeping, some personal care, making sure that your loved one is safe, transporting them to doctor's offices or taking them out for a drive. I think that it's important to know that this is private pay. If you have long-term care insurance, and I'm not sure how many of you do, we can talk about that a little bit later as far as what to look for. If you have not turned 70 yet and you're the one without the diagnosis, it is something to look into as you're younger to help pay for care later on. If you have a policy, I'll talk about some details after. Veterans benefits, again, if you or your loved one, so this is for the veteran and their spouse, there are some veterans that help pay for both home care and community care settings. There may be some of you out there that are leaning towards Medicaid or already on Medicaid. There are services called home and community-based services, and what that simply means is once you discover what home cares can provide care under Medicaid. There are very few, but again, all of these questions here or all of these statements is I can direct you to each one of these depending on your scenario. For long-term care, I think it's important to pull your policy out if you have one, identify who's the contact person, and make a phone call due to the fact that many of these companies end up buying out each other. So maybe you had that long-term care policy written years ago and it might not be owned by the same company. Really get your ducks in a row to know who your contact person is. And when the policy is turned on, when the claim is made, it is made because you now know that 2 out of the 5 activities of daily living that person is struggling with, whether that's bathing, dressing, grooming, feeding, and then just general mobility. A nurse would come out and check to see if that person does qualify for it. They then open the claim. You will then identify whether you're going to have home care, which it's not saying in here, home care, nursing care, or assisted living. And you really want to make sure your policy explains exactly what it covers. I came across one, she was ready to move into assisted living, but she identified that it only covered nursing care. And that means like a nursing home or skilled nursing. But that policy was written years and years ago when assisted livings weren't a big thing. So it's really good to review what the daily rate is, meaning how much will they cover out of the care costs. Maximum benefit, meaning is the benefit for 3 years? Is the benefit per day endless? So it's really important to get that out. Typically, there's an elimination and waiting period where you would be paying privately for a period of time, like 30 days, and then it kicks in where they begin to send you a check. And again, letting them know so they can explain the claims process to you. For additional benefits, so those out there that may be wartime veterans, and the reason I say wartime veterans is that you have to have been served in a foreign war, and I have all the information of which wars those are. I can send anybody information on the VA, how to get in touch with them for different health or benefits. Each county also has a veterans office to see and give a call, maybe make an appointment to see, are there any extra benefits? I know sometimes they cover a day program. Sometimes they cover a home care program, as well as a discount in assisted living. And because it's so broad, I don't have all the details because it depends on the person and the spouse. It helps to pay for care. In some of their programs, you have to qualify financially. Other programs, you do not. So it's, as we all know, it's hard to get through to the VA, but I have a wonderful document with QR codes that would take you right to the right website. I'll send that on to Annie, and she can send that out, or I can send it out. For those of you that are looking about Medicaid, if your loved one, if you are caring for them and you think at some point they may end up going into a community to live, you can meet and understand whether, if your loved one goes on Medicaid, but you do not, then you can protect your home and one car. And again, there's lots of information on that. And I do recommend that you go to the healthfirstcolorado.com. They do have, they don't call them social workers, but they call them intake specialists that can really help explain the program based on your situation. InnovAge is a Colorado-only Medicaid. It has a health center, it has a day program, and it even has some communities that take InnovAge as payment for part of their assisted living. It can get very confusing. So I'm doing kind of a 10,000-foot look at what's out there and things you might want to consider down the road and explore. So let's get to the next slide. With the VA benefits called aid in attendance, again, we talked about qualifying financially and with those activities of daily living. I looked up the benefit for whether it's a single veteran or their surviving spouse. They do mail you a check if you qualify for either $14.78 if you're a spouse or $2,300 a month if you're a single veteran. It also works for married veterans at the same time. So again, these change annually, and this is the current rate. And this really explains that it can be of great benefit. And we have people that I know that do this application for you for free because it's quite consuming. Your veterans office in the county, but I have a couple of resources that can do that, walk through it, because it's about an inch worth of paper that you're going to end up going through, and they can walk you through what you need. We talked a little bit about activities of daily living. And I wanted to just say cognitive and physical limitations is also part of the activities of daily living. And as we know, either with some forms of dementia or PD, of course, with physical limitations, this becomes a part of your ADLs that if you're struggling with and you need either veterans benefits or long-term care, that would allow you to get qualified once you set that claim into play. Now, why would you consider moving from home? Most people want to stay at home for as long as possible and as long as they can. But again, there may be a few reasons why considering moving from, well, this one is about actually getting in home care. So bringing in care. The spouse is the caregiver, everything is going well. You're really there for your loved one, but the number of falls continue to increase. The home, the more like you bring in a walker, maybe a wheelchair, it becomes no longer suitable for moving around, or you have, your master bedroom and bath are upstairs, and it's getting harder to get upstairs. And then the care partner may be working outside the home. Lily has a client right now. Her husband has Parkinson's, but she still owns her own business and needs to be at work every day. So that makes it hard. So she brought in a care manager to help during the day. But the other part here is we certainly don't want this to happen, but the spouse ends up declining, having surgery or hospitalization, to have a backup plan, to have talk to somebody in home care, talk about how much it costs, and getting everything ready just in case, and then calling them back and say, I'd like to consider starting. But at least you've done the homework. It's just really a way to look ahead. Home care can be as simple as companion care, but it also can help with that personal care, such as bathing, dressing, grooming. And it can also help overall for meal preparation, especially for those that are living alone with PD. I think it's good to think about bringing in somebody that when you get to the place where it's more difficult, this person can not only be a companion, can also take you to appointments, can make sure you're taking your medications online, and even do a standby with bathing and dressing and grooming while you do it until the point where you can't. So it is not covered by Medicare, as we talked about. It is private pay. And I went to the Denver area, and we're looking at anywhere from $38 to $45 an hour. And most home care agencies have a 3 or 4 hour minimum. So when they come, they can be doing a variety of things, not only doing the main things, but like meal prep is something that is optional. Light housekeeping is optional. But if they're staying for that amount of time, then it's really helpful for them to help with other things as well. And as you can see, it can get pricey. My parents happened to have 24/7 for many years. Thank God my dad had the resources, but very few people do. And we're going to talk about when that gets too expensive. So now transitioning out of the home. So as we talked about, there may be some circumstances, and you're thinking maybe I need to consider and take a look at some places near me. I'm the caregiver, the spouse, or as a single person with PD, when things just get too difficult to stay home. So a family caregiver can no longer physically do all the care. There are more falls happening. There seems to be hazards in the home, whether it's a big dog, that when my daughter comes over and brings her big dog and my dad seems to trip on that dog often, that kind of thing. We just saw how much home care can be when you are increasing it. It ends up being beyond your budget. Isolation. I think one of the things a care setting can provide, and I'll talk a little bit more about that, is just if you're there and you're not getting stimulated or doing activities, or you're not able to get out and take a drive or go to the museum, or go see a movie, these kinds of things, as the disease progresses, you might end up being at home more, which is not as stimulating. In a care setting, there's lots of different activities you can opt in to, and it's very much of a safe environment. Homes can become unsafe even after putting grab bars and railings. Maybe using appliances is getting more difficult. So these are just a few considerations. What is assisted living? Well, there's two different types. The big buildings that you see out there, out and about, those typically start in independent, have assisted living, and then also memory care. And it's more like an apartment with activities, restaurant style dining, and then they do an assessment for what care needs you may have that they write a care plan for. Have lots of community space. And memory care is just something I keep on here because they do have secured environments for memory care. We also are finding a lot more of the residential care homes. So, for example, I have someone that I placed in a small residential care home with Parkinson. She kept her husband home for as much and as long as she could. A year before, she toured 2 or 3 of the small care homes with me, right up the street from her, typically in a residential environment. It's more of a home environment. They're more affordable, they have more oversight, and it's typically when they get to the place, and it's tricky. They want to get to the place where that person can still participate and be part of things instead of not, and be able to communicate with the team. It's just a more intimate environment. Um, and that is what's out there for what we consider assisted living. For paying for assisted living, how would you pay for that? And some folks are selling the home, and they can use the proceeds of the home. Of course, savings and retirement. And this would be where I would say talking to your financial planner, your family, trying to understand how we might put money into a trust to help pay for care. We did already touch on long-term care and pension. We talked about Medicaid. There are very few homes that are Medicaid. Some do a spend down, but again, that's difficult because there are very few of those around. And then, of course, your Social Security check that you're getting monthly, if you're over 65, that can help. We always suggest that you talk to your family and financial planner, if you have one, about that. Skilled nursing is more of that 24-hour nursing. That's more like a nursing home. They do take private pay, long-term care insurance, Medicaid. If you are at skilled nursing for rehab, let's say you did fall and break something, or you are rehabbing, let's say an elbow or a knee, Medicare would typically pay for the short-term rehab. Really today, we also want to talk about who is your team? Who should you have on your team? What does that really mean? Is that for a caregiver or for one living with PD, you really want to spend your time the way that best serves you and your needs as well. So I think it's important to have somebody to avoid duplicate service costs, meaning overlapping, talking to an expert, finding the right resource that you can afford, advocating throughout those stages of PD, and then identifying what the care needs are coming up. In other words, you've talked to a neurologist, you see different things that are changing and sort of understand that care need, overseeing the care plan. So we're kind of getting into what a care manager could do. A care manager can oversee, let's say you have home health coming in to do physical therapy, or you're going out for physical therapy. Let's say you are bringing in home care. This care manager can help put all these things together and make sure you're getting the best bang for your buck, so to speak. Monitor the services provided. That simply means as well that if a care company is in your home providing care, that a care manager can make sure that they're doing their job, that if any changes of condition is being noticed after an appointment, that gets communicated back to the home care company to put back in the care plan. Centralizing and coordinating. For example, if you have 2 doctor's appointments in 1 week with 2 different doctors, she makes sure that the coordination is happening between the doctors and the communication as well with family members, whether they're local or long distance. Arranging respite breaks. This can happen to caregivers that are really doing all the work. I know the woman I helped to place her husband, she needed to go away even just for a week for a wedding, or to go away for a break to see some friends. A care manager can help get somebody in there for a period of time. Engaging and involving family members, educating them on the disease state. And I know PAR does a fabulous job with that, but to have a one-on-one person that can help with that. Reducing stress with informed responses. That's being educated, taking a moment to consider what the choices are that you have in front of you to make the best decisions. Peace of mind for you and your family. I think it's really to have your team, and we're going to talk a little bit more about who else is going to be on your team. So I wanted to just quickly tell you a little bit more about what we do at Aging Life Care Manager. This is Lily Hoteling. You saw her picture. And I'm going to go over this pretty quickly, but certainly you can contact me with more information. I want you to understand what a care manager can do. Evaluating, arranging in-home care, we talked about, coordinating medical appointments, arranging transportation, Advocating, that's one of the most important pieces. We call this job like a project manager or a quarterback, really putting all things together, identifying the local resources and programs that can help families during this time, making referrals. If you don't have a legal, financial, or medical professional, she vets those out and makes recommendations to you or the family. Explaining complex and difficult topics to families as well, understanding kind of the medical piece of it and possibly the financial piece of it. Making those long-term, short-term and long-term plans. She's taken care of people that have lived at home for a long period of time, and at some point they needed to move, so she helped them with that transition as well. And really, she's boots on the ground. So if anybody that's on today is a solo ager, meaning you don't have family here, you have family out of state, this is where this really comes in handy. Making regular visits and assessing their progress. And then the communication piece is really important. So that's what a care manager does, and we have one of those in our company. The rest of the folks, you really want to make sure that you choose the right power of attorney. You talk to your family and friends about supporting you and what it is. And if they say, is there anything I can do to help? You should have a little list of things that would be helpful that maybe you can't get to as a care partner or one living with PD as well. Of course, your healthcare team. These are folks that can be very helpful. Of course, your physicians go in with your list. Even get a list to your physician prior to going, that helps. Talking to pharmacists at the window about possibly a new medication you're going on. Mental health, taking care of yourself and what you're going through, and getting a therapy team if you feel like that would be helpful to you as you navigate this disease. Now, we talked about home care agencies, caregivers, of course, therapies, but that could also be counseling coming to the home or going out to. Of course, legal, making sure you have all your documents in a row, that you review those documents as well. Looking at financial, your advisors, what insurance you have, doing some tax planning. I believe that when you hire home care, there is something you can write off for medical care. And then placement, that is the other part of where we come in. Home care, Answers for Senior Care, we can help with touring and picking out a place that would be appropriate. And that is a free service. So like a realtor, we get paid by the building you move into. A realtor can also be a good source of a resource for you to say, well, what do I need to do to my home if I'm planning to move out? Or are we going to sell it as is if that comes to that time? A moving specialist, I have resources for that if you are just downsizing to a smaller home that's more appropriate. So there are many different areas to consider. And I think it becomes difficult to go, how am I going to do all of this? Well, all I would say to you is doing it one step at a time, getting one task a week taken care of, whether you're a caregiver or living with PD. This is really kind of a list, and this would be a list of folks. Have I touched base with these folks, made my wishes known, etc. So I think it's just important to consider building that team. So if you have no plan at all, making quick decisions just really doesn't give you the best outcome. And when you're limited on time, to find the best professional to guide you and support you is not always the best idea too. If you have any cognitive along with physical decline, it's really good to coordinate your future care. And of course, we know high emotions are really difficult during this time, making big decisions. Family dynamics, I put that in there. There is a reality to that, but this is really your decision, and hopefully you build that team along with family to get the kind of care that you need down the road. So be proactive, plan ahead, build that team, go over that list, which I can get over to Annie as well. And sometimes plans do shift, whether it's a fall, but having things in place is important. And wanting to age at home and being able to age at home is something that is not always possible. Of course, don't wait for a crisis. Be informed. Knowledge is power. And I added this because I run a support group for Alzheimer's Association, and I've done it for 10 years. The resources and the support that come out of the group amazes me, and I'm really just a facilitator. But those going through, if you are part of it, excellent. If you are not, I really highly suggest that you join a group through the PAR. Great supporter. I think it's important to know too that we have to have a sense of humor, because when I get to the end of the presentation, it feels like, oh my gosh, lots to do. This is hard. What does the future look like? We all need to have some sense of humor through it all, and be able to take a moment, have a good laugh as well. So now I will close up my screen, and I'll have Annie open it up for questions. These are Lily's dogs, Lily and Phil's dogs, and my new dog on the right. Thank you so much. I will leave the slide up for a moment. I am the bottom one. If you do want to contact me and you have questions about everything I went over, or down the road you have questions, feel free to give me a call. Again, I'm the resource specialist, so it doesn't cost anything to talk to me. It's me connecting you with resources with my 10 years of experience. Annie, thank you for having me. I appreciate it. And I look forward to the questions. So let's see how I can, yeah.
So the first question is going to be if everyone that attended, they can get a copy of the slides.
Sure, I can send that to you, Annie.
Okay, wonderful.
Now I'm trying to get my face, share my webcam. Okay, there I am. I can't see anyone. Am I supposed to be able to see people?
Nope, you're good. And you can leave the contact information up. Okay. Someone asked, I believe, can you talk a little bit more about respite care?
Yes. So there's different kinds of respite care. There is respite care that a home care agency can provide if you set it up. I've had a few calls of folks that are going away that are the main caregiver, and the main caregiver wants to or needs to get away. When you talk to a home care agency, they typically want to be able to meet the loved one first and maybe do a couple of days ahead of time meeting your loved one. So it's not just somebody showing up at the door and your loved one has never met them before. So they typically do a week of care, and if they do, some can do overnight care and some can do daytime care. So respite care can also be in a community. So let's say you are going home or you're having company come in and it's been too difficult caring for your loved one. They actually can call me, and what I do is I call around to find out if any of the assisted livings have a respite room, and that typically changes based on if they're full or not. If they are full, they typically do not have a respite room. If they're not full and they have a respite room, it's typically a 30-day respite. Very few communities are doing less than 30 days. I can tell you how some people have used that as well. Is I'm not sure if he's going to like it at this community. Could we do a 30-day respite? See how he does, see how I do. So it just varies. And respite care is just basically a caregiver either coming into the home and doing all the care needs, of which they obviously would be talking to you in depth about the schedule of medicines, about activities, about meals. And then the same is true if you go into an assisted living for respite care. They would actually do an assessment. I don't know home care pricing, but I do know that if you are typically going into an assisted living, And if I can ever find one for 2 weeks, I can ask, but it's typically anywhere from $195 to $225 a day. And they are typically managing meds, gets his meals for that, make sure he's, there's usually therapies in the building, activities if they want to take them down to those things. So that's what respite care is. But I know there's also a respite coalition. Annie, what I'd like to do after I send my slides is also send the information on the respite coalition in Denver. I don't know a lot about it, but I'd like to look into that for you all.
Perfect. Someone else asked, I don't understand how a care manager is obtained. Also, what are the costs for engaging a care manager?
That's a great question. Care managers are engaged. There's only about a half a dozen to a dozen of them in the Denver area. Lily has about 15 clients right now. And engaging a care manager would just simply be giving us a call saying, I'm not sure if I need a care manager. How does it work? What does it cost? It totally depends on the client. So if the client needs just some oversight and has a caregiver at home, a loved one, it may be putting together a care plan and checking in once a month. Most of our clients are visiting with them once a week, taking them to doctor's appointments, making sure they get groceries in. So overall, making sure that if they need somebody to help with bill pay, and then coordinating between all the doctors. I'm trying to, because she does so many different things. Helping with anything that's going on with the home itself. She's had to have trees removed, septic systems taken care of. So she's sort of boots on the ground for all aspects of life. What does it cost? It is private pay, and it's anywhere from $85 an hour to $130 an hour based on how involved she gets. As the one that she's doing with the Parkinson's gentleman that she's caring for now, it's really not a lot of involvement. It's making sure he gets a full calendar, gets to his boxing classes, gets to his exercise classes, gets to his doctor's appointments. And then the wife comes home and is there for the rest of the evening, making sure he's taking his meds. They may bring in a caregiver to help during the day as his disease progresses. Let me know if I answered that properly for the person that asked me.
Like I mentioned, you can type in the question box or you can raise your hand. There's the little hand icon and I can unmute you. Yes, the person said that was a good answer. Thank you.
Okay.
Any other questions?
I will go ahead and send Annie this slideshow that she can send along to those that participated. You know, I wish I could cover everything that I help with, but it's more, if you have a question, we title the name of the company Answers for Senior Care because you're not sure where to go. Don't hesitate to call me because I've been doing this for 10 years and I have connections. One thing I didn't mention, for example, if you need your house modified, if you'd like to bring in a chairlift to go up the stairs, if you need grab bars, if you need a ramp, if you need to modify the look and feel of your bathroom. I typically work with accessible medical systems, but I have others that I work with as well, meaning I would give you their name and number. You know, if you're considering end of life planning and you haven't done it, you haven't sat with your loved one and had that conversation. I have folks that in the industry that are fabulous about really meeting your wishes and talking it through. Estate planners, I know that PAR has a lot of connections as well, but I just want you to know that I have a list of questions to ask home care agencies. Yeah. And I think it's important that if any of you want to tour a community because you've never been in one and you have this idea of it, Having the person with PD be part of the decision-making process is key in bringing him or her to the tour if able, but to also just have that in your back pocket that you've checked it out, you know how much it's going to cost, you have a gut feel of it, and that your loved one would do well if and when that's needed.